Hello and welcome to a fresh episode of 2 Minute Physiatry. Today I shall be discussing a common cause of heel pain called plantar fasciitis or PF for short. It commonly occurs in people who have to stand for a long time. In order to keep the arch of our foot, there is a very strong ligament coming from the heel to the bases of the toes. This is called plantar fascia. For those who have to stand for a long time, there is stretching of this ligament over here, giving rise to microscopic tears and presents as a heel pain. Typically, this pain is worst in the morning when the patient tries to get down from his or her bed and the initial first few steps he or she walks is painful. Then later in the day, during the course of standing, maybe as part of his or her profession, or being a homemaker, they need to stand and walk for a long time, this pain aggravates and usually subsides with rest. Diagnosis is quite easy. It's mostly clinical. By palpating, by pressing on the sides, especially the inside or downwards, the pain is elicited. X-ray can be done, but presence or absence of a bone spur over here is not confirmatory of the diagnosis. Many people without this condition may have a bone spur. Many people with plantar fasciitis may not have a bone spur. So once this diagnosis is reached clinically, the first thing we need to do is to prescribe a shoe modification. There should be a heel cushion, either by a sponge or a high density rubber or a silicone material, to dissipate the forces concentrating on one particular point. And it's important that the patient wear these shoes both indoors and outdoors, almost at all time when he or she is standing or walking. A warm foot bath at night also helps in relieving of the pain, and once the pain is relieved, maybe with some additional analgesics as well, there needs to be a stretching exercise regimen of the plantar fascia. This has to be continued for a long time along with the modified shoe usage. In certain conditions, we need to inject a corticosteroid right where the pain is at the junction of the ligament and the bone. But the caveat is that too many injections will actually cause a weakness of the fascia. This injection has to be reserved for cases which are not responding to conservative measures. If you like this video, please press like, subscribe to my channel and share it with your friends and close ones. And I shall be back with a fresh episode of 2 Minute Physiatry. Bye.